Hi, my name is Nicholas Carter Hopkins, and my career goal is to earn my DPT and become a physical therapist. Hopefully, then moving on to one day open up my own physical therapy clinic. For my fictitious scenario that I created, I was shadowing a physical therapist in an outpatient clinic where we saw 3 different patients, 2 of which were continued patients, and 1 of which was a new eval. So for the first patient that we saw, it was within their 1 p.m. time slot where we treated a patient with a torn oblique located laterally within the abdominal region of the body. The tear occurred within the most superficial level of the body's muscle tissue. The injury took place 4 weeks ago, and the patient has been visiting the clinic 3 times weekly for the past 3 weeks. Progress has been achieved through varying combinations of active muscular stimulation as well as rest. Overall, both the clinician and the patient are pleased with the results and will continue therapy until no limitations are any longer present. Now, this was for my first patient. For the second one that I followed the therapist with, it was an eval on a patient who is suffering from polytrauma resulting from a head-on collision car accident that occurred 1 week prior. This polytrauma consisted of multiple injuries, the first of which being a femoral shaft fracture, an iliac crest avulsion fracture, and lastly, a compression fracture to the lumbar spine of the patient. The proximity of these 3 injuries limited the therapist on the selection of exercises she was able to introduce to the patient. So therefore, it was decided that she would not be performing strengthening exercises throughout any full range of motion for at least 2 weeks. To begin treatment, the patient will be performing non-weight bearing and will be doing these exercises from a supine position, which will be pretty much focused on passive range of motion as well as isometric light muscle contractions. For the third patient I shadowed, the therapist was working with a patient that she had seen before for a few weeks. And this patient is suffering from dyskinesia, which is overall contributing to her generalized weakness. This is an older patient who worked a sedentary job for the majority of their life before retiring 2 years ago. This patient began therapy 5 weeks ago and has seen tremendous improvement in his quality of life. Within this session, the therapist wanted to prioritize specific physiological functions such as standing and sitting with minimal added resistance. The resistance that we chose for this session was holding a 5-pound dumbbell, and also the use of resistance bands. This was done in order to improve postural imbalances while ensuring limited stress upon the body. The therapist prescribed continued sessions bi-weekly for 3 more weeks, at which point the patient's condition will be reassessed. Overall, the day was a success, and the afternoon was spent treating and evaluating patients of various conditions. The therapist demonstrated an above satisfactory level of competency within each case and continued to be devoted to the improvement of each patient within her field of care.